have a facelift is so personal, and for me it was extremely spiritual as well. I wanted to make sure that I was doing this for the right reason. And the right reason for me isn't because society's doing it, because it's in a magazine and that's what women my age do anymore. It was more of an internal, what can I do to improve myself? And there's an awkwardness about that. There's an uncomfortability, I believe, in women my age, thinking that maybe they should just settle for where they're at. Maybe there's even a little bit of shame that you're doing this procedure. Recently, I just turned 60, and before that, I went into a time of reflection, looking at some photos, and it was definite that over the last 5 years, those areas had shown the most decline because of the aging process. The last, I'd say 3 to 5 years, I've just noticed a little bit loss of volume in my face. I've been noticing some of the folds. Just didn't have the glow, the refreshed look that I once had, even as recent as 5 years ago. I could definitely see that there could be some possible improvement, I was thinking, through seeing a plastic surgeon. Right away, I made the consultation appointment and I went in, and what I really liked is I felt that the atmosphere was professional, it was relaxed, it was realistic. That's what I wanted. Not a lot of glam, not something that wasn't achievable to be done to me. I made a decision there right then, that day, that this is what I wanted to do and felt very comfortable with it. I was surprised that the surgery center was at the same location as where Dr. Z's office is as well, recognizing that it's a surgery center as well as he has his private practice. And I was quite impressed by that. They went ahead and brought me in and prepared me for the surgery, and that required getting an IV in me and taking the medical history, and the anesthesiologist was in. He double-checked the medical history, and then another nurse just came in and triple-checked the different things about me, my medical history, so I feel real confident.
Excited?
I'm excited.
Wow, fantastic.
So on the gels, in reviewing some of the different client profiles, I noticed some are subtly done,
Yes.
and then some, the gels disappear.
Right.
Where will mine be so I have a realistic expectation?
It'll be significantly reduced. Yeah.
Okay.
So we're going to be pretty aggressive. Your overall contour's pretty good because you have such a well-defined jawline, you have really good bone structure, but we have this crepiness, and then also we can see the outline of a muscle here. This is called the platysma muscle, and it's a muscle of facial expression that you use when you grimace. And so we're going to weaken that muscle so it's not as active, and also recreate the youthful tension so that will go away. We're going to do the deeper structures so that we can reposition it. We take out a little bit of the excess, and that's also going to help with the jowl and the area in the lower mouth.
And then where does the fat come from?
Right.
For the folds?
Right, great question. So it comes from that same structure, the SMAS.
Okay.
When we tighten that up to give it that, again, restore it, there's going to be a little excess of that. And I'm going to take some of that out, and then instead of throwing that away, we're going to recycle it. We're going to be green. And right, we don't want to waste, right? And so we're going to make a small incision here, which is going to be near what we call the nasolabial fold, which is a little prominent on you.
Okay.
And then another small incision here, and we're going to thread it through to help soften that fold.
Oh, nice. So it's really, this fold is not going to be eliminated through a pull.
Correct.
It's just, if anything, the volume's going to go back
Correct.
into the area.
Exactly.
Okay, got it.
Exactly.
Got it.
Your case is a really fun one for me as plastic surgeon, because I think there's so many wonderful attributes of your face, and then we just have this one area that's aging a little aggressively, and the neat part is that we have the tools to really do a great job and restore balance and really have a fantastic result. I tailor my facial procedure to what the patient needs. So there's SMAS facelift or subperiosteal facelift or deep subcutaneous facelift. There are all these different kinds, and I personally am not wedded to any particular kind. I change some of my markings a little bit during surgery, so these are just kind of general landmarks that I use. I like it. I like it.
No, I'm ready.
Good.
Yeah.
Good. All right, so we're about ready to start the procedure. We're going to do a SMAS facelift, manipulating and rejuvenating the ligaments to the facial muscles. And that will allow us to help with her jowls, which are her biggest concern. We will also lift the neck, and then an upper eyelid lift, also known as an upper lid blepharoplasty. We're going to release the mental and medial mandibular ligaments, and we're going to graft some tissue into the pre-jowl sulcus in front of the jowls to help soften that transition from the cheek to the chin area. Cassie seems very excited about and very realistic about what we can do, and actually realistically we can do quite a bit for her. We've just injected some local anesthetic, so that decreases the requirements for anesthesia. My team, they're getting Cassie prepared now. We have braid her hair and prep it for the procedure. I'm very dependent on this incredibly organized staff, including Erica, my head nurse, and Dr. Rose, to keep Cassie safe and happy. This is her first procedure, and I think she's going to be very pleasantly surprised at how comfortable she is when she wakes up. I am now just transitioning from my initial incisions, freeing up the skin from the deeper layers and going into the subcutaneous layer. And I will have my assistant Michaela retract the ear slightly, very gently. I want a little pull here, deep down. And that, I have the light shining through the tissues, and that allows me to gauge the depth and see the plane of where I need to be with my dissection. We've made all the incisions, we've started our initial undermining, most of the back of the neck is already done. And now I'm going into the upper part of the scalp and the face. Doing the meat of the procedure at this point, and very happy with the way things are going. Dr. Rose, how is she doing from an anesthesia standpoint?
Well, it's several things you have to take in consideration. The heart rate, the blood pressure, but most important, her response to various stimuli from the surgeon. Cassie is an ideal patient for this case because she's very healthy and she doesn't smoke, she doesn't have any problems with her lungs, and she exercises regularly, so her cardiovascular system is stable. It's not something you always see in the typical facelift patient.
What's really great is we're getting very little bleeding because we have the excellent effect of the hemostatic agent that decreases the amount of bleeding and also decreases or masks any pain. Again, decreasing the amount of the anesthesia that we need for the operation. And it's great to have someone like Michaela, who has a lot of cosmetic surgery experience, to help me out.
I really like working for Dr. Zewert. This is a wonderful surgery center and we have a great team here. Dr. Zewert is a perfectionist. He takes his time and he gets things exactly how he wants them to be done.
Because we always know that the patient is first, and we want to shoot for perfection, where you're minimizing trauma to the patient, and you're minimizing time on the operative table, and all these things that help the final result. It's a big deal. Wouldn't you say, Michaela?
Absolutely. There aren't tons of surgeons coming in and out doing all sorts of different specialties, so everybody's very comfortable with the procedures, the Dr. Zewert schedules. We've all done them before, we've seen them before, we know how to prepare for them, and that's a lot less anxiety than working in a hospital setting where I have to be prepared for anything and everything.
So now I'm getting to the point where I'm looking at the platysma muscle, which is that band muscle that the patient has, and I'm doing a procedure called myotomies, which are essentially softening the look of the platysma. Between that and repositioning that muscle, she will be able to have a softer look, a more youthful look, very little or no banding in her neck. I'm going to work on this jowl area. So I'm freeing up that area now. That's where the ligaments are. And I'm also going to graft a little bit of tissue, some SMAS into that area, that little sulcus, that little depression. And that's also going to help with the result. So we're doing 4 or 5 special things for Cassie to really tailor the operation, specifically to be very aggressive with her jowl, because that's a really advanced problem for her. Here I'm going behind this tragus. All right, there it is. Let's check it out. That's the tragus there. We're going behind it so you don't see the incision. And the skin is very thin here. So you have to do your incision. You have to be very careful not to injure the cartilage underneath. You do the incision behind the tragus. You do it in front of the tragus. How high up do you take the incision here? The higher up you take the incision here, the less noticeable it is, right? However, you have to have a healthy patient, because the higher you bring it up, the more the blood supply is going to be challenged. So if we don't have a super healthy patient, or someone who has a smoking history, for instance, I've got to take that incision a little lower here. Even though it's more visible, I need to do that. But Cassie's in such great health, I can bring it high up. So that's key.
I'm subbing in for Michaela right now, our tech, and we are just moving along in our procedure here. Cassie's doing really well. We are about to start sewing, right, Dr. Zewert?
We are about to do the SMASectomy. We're going to remove some of the SMAS and get the SMAS fat graft. And Eric has helped so much. It's really fantastic.
Yeah, it's really nice to be cross-trained. Most of our nurses here are cross-trained for pre-op, post-op, and intra-op. So that's really good for our team. They're able to help the patient in all areas of care.
I'm harvesting the portions of the SMAS, and then I'll undermine it and tighten it. I use a semi-permanent suture. The suture lasts long enough that the SMAS will heal in its new position. I've resected a portion of it. I haven't had to do a ton of undermining on the side, as it was less necessary than I thought. And now we're just sewing it together.
The area that I was struggling with before was in this jaw area here, as well as I felt that my neck was a little bit loose. All I can say is it was just a really wonderful experience, and I'm so pleased with the results. I did also have a procedure above my eyelid to tighten that area, and I wasn't sure if I really needed that, but now I see just an incredible difference there as well. There was no doubt in my mind as to the level of proficiency and the professionalism and the knowledge that the doctor as well as his staff had in the pre and the surgery and the post experiences that I had with the office. Each time I felt very comfortable with each staff member and especially the doctor. And I just had a real sense of ease and comfort that, you know, this was not the first plastic surgery he had done, and his credentials and his experience brought me so much comfort. And sure enough, each week it just got better and better. I love putting on makeup again because I do see the change and I feel the tautness, but not in a way that it looks phony. It's just natural. And I know that my husband likes the results. He doesn't like them, he loves the results. Recently we celebrated an anniversary and we were talking about what we love or like about each other. And he said one of the things that he loved about me is I have a youthful attitude, and I couldn't help but think that the way I look also helps the youthful attitude. Getting in and getting a consultation and knowing what you're dealing with would be the starting point. And if you're challenged with some areas and you don't like your chin, you think you'd like to do something with your nose, or just get a little bit more sculpturing around the face, I just would strongly suggest that women do it. I think that being prudent, discerning, you know, what's right for you, why you're doing it, the right reasons, and then go for it. Go for it.